Hey there, welcome to our channel. Today we're diving into a crucial topic for cancer patients and their care teams. We're talking about courageous conversations. These are the tough, honest talks that can make a world of difference in your care. Have you ever felt like there was something important you needed to say to your doctor, but couldn't find the words? Or maybe you're a healthcare provider who's struggled to have difficult discussions with patients. You're not alone. Many people find these conversations challenging, but they're essential for better care and peace of mind. Let's explore why these talks matter so much and how to have them effectively. Courageous conversations in cancer care go beyond everyday chats. They're the talks that address serious concerns, fears, and important decisions. These discussions can cover everything from treatment options to end-of-life care. They're called courageous because they often require bravery from both patients and healthcare teams. It's not easy to bring up tough topics, but avoiding them can lead to misunderstandings and poor care. So what exactly makes a conversation courageous in cancer care? It's when you openly discuss issues that might be uncomfortable or emotional. For example, a patient asking about their prognosis, or a doctor explaining why a treatment isn't working as hoped. These talks are different from regular feedback or casual updates. They tackle the big, sometimes scary questions head on. Why do people often avoid these important discussions? Fear is a big reason. Patients might worry about hearing bad news or seeming ungrateful. Healthcare providers might fear upsetting their patients or admitting uncertainties. Cultural barriers can also play a role. In some cultures, it's considered disrespectful to question a doctor or discuss death openly. Emotional challenges are another factor. Cancer is overwhelming, and sometimes it feels easier to avoid difficult topics. But what happens when we don't have these conversations? Silence or avoidance can lead to misunderstandings, unmet needs, and missed opportunities for better care. Patients might not get the support they need, and doctors might make decisions without full information. That's why learning to have courageous conversations is so important. Let's talk about the key elements that make these discussions effective. First, there's clarity of purpose. Before starting a tough talk, it's crucial to know why you're having it and what you hope to achieve. Are you seeking more information about your treatment? Do you need to express concerns about side effects? Being clear about your goals helps guide the conversation. Respect and empathy are also essential. These talks work best when everyone feels heard and valued. This means listening without judgment and showing understanding, even if you disagree. Creating a sense of psychological safety allows everyone to speak openly. Balancing honesty with compassion is another vital element. The truth is important, but how it's delivered matters too. For example, a doctor might need to share difficult news about a treatment's effectiveness. They can do this honestly while still showing care for the patient's feelings. Managing emotions during these talks is crucial. Cancer discussions can bring up strong feelings like fear, sadness, or anger. It's okay to acknowledge these emotions. Taking deep breaths, pausing when needed, and speaking calmly can help keep the conversation on track. Choosing the right time and place also matters. A rushed conversation in a busy hallway isn't ideal for discussing important concerns. Finding a quiet, private space and ensuring there's enough time can make a big difference. Now, let's get into how to actually start and guide these conversations. Preparation is key. Before the talk, think about what you want to say. Write down your main points, if it helps. Try to anticipate possible reactions or questions. This can help you feel more confident and focused. Setting ground rules can create a safe space for tough talks. You might agree to listen without interrupting, to speak respectfully, and to take breaks if things get too intense. These rules help everyone feel more comfortable. When you start the conversation, it's often helpful to begin with facts. State what you know or have observed. Then you can share your thoughts or concerns about those facts. This approach helps keep the discussion grounded and clear. Asking open-ended questions is a great way to encourage dialogue. Instead of yes or no questions, try asking things like, "How do you feel about this treatment option?" This invites more detailed responses and deeper conversation. Active listening is crucial in these talks. This means really focusing on what the other person is saying, not just waiting for your turn to speak. Try repeating back what you've heard to make sure you understand. At the end of the conversation, summarize what you've agreed on or what the next steps will be. Sometimes these conversations can get emotional. If someone becomes defensive or upset, try to stay calm. Acknowledge their feelings and gently redirect the conversation back to the main points. Remember, it's okay to take a break if things get too heated. Now, let's address some common challenges in having courageous conversations. Fear and nerves are normal. Recognize that it's okay to feel anxious about these talks. Taking deep breaths and reminding yourself why the conversation is important can help. Power dynamics can make these discussions tricky. If you're a patient talking to a doctor or a junior staff member speaking to a senior one, it might feel intimidating. Remember, your voice and concerns matter. It's okay to respectfully express your thoughts and ask questions. What if the conversation doesn't go well? It happens sometimes. If this occurs, take some time to reflect on what happened. Think about what you might do differently next time. Consider following up with a letter or another conversation to clarify any misunderstandings. Building habits for open communication takes time and practice. Try to have smaller, more frequent check-ins. This can make bigger conversations easier over time. Let's address some common questions about courageous conversations in cancer care. How can you tell if your care team needs a tough talk? Look for signs like feeling confused about your treatment, having unaddressed concerns, or sensing tension or miscommunication. What if someone gets upset during the conversation? Take a moment to acknowledge their feelings. Offer to take a break if needed. Remember, emotions are a normal part of difficult discussions. How often should cancer teams have these discussions? There's no set rule, but regular check-ins can be helpful. Major decision points in treatment are good times for in-depth talks. What if your hospital discourages honest feedback? This can be challenging. Consider speaking with a patient advocate or looking into patient rights in your area. Your voice matters in your care. Are courageous conversations only for handling problems? Not at all. They're also great for expressing gratitude, sharing positive feedback, or discussing hopes and goals for care. What resources can help improve communication skills? Many hospitals offer communication workshops. There are also books and online courses on medical communication. Don't hesitate to ask your care team about resources. Courageous conversations are a powerful tool in cancer care. They help ensure you get the best possible care and support. Remember, it's okay to speak up, ask questions, and share your concerns. Your voice is an important part of your care journey. We hope this video has given you some useful tips for having these important talks. If you found this helpful, please like and share this video. Do you have experiences with tough conversations in cancer care? Share your thoughts in the comments below. Thanks for watching, and remember, your voice matters in your care.